Hi and welcome back to another video of Medic Notes. This video is on dengue fever. Dengue is a mosquito-transmitted virus and is the leading cause of arthropod-borne viral disease worldwide, posing a significant global health concern. This disease is also known by various monikers, such as breakbone or 7-day fever, and is characterized by intense muscle spasms, joint pain, and high fever, reflecting both the severity and the duration of symptoms. Although most dengue fever cases are asymptomatic, severe illness and mortality can occur. Aedes mosquitoes, primarily including the female vectors Aedes aegypti and albopictus, transmit the virus and are common in tropical and subtropical parts of the world. Dengue fever is caused by any of the four distinct serotypes, DENV1 to DENV4, of single-stranded RNA viruses belonging to the genus Flavivirus. Infection by one serotype confers lifelong immunity to that serotype but not to others. The consequences of a mosquito bite injecting the dengue virus into the skin remain unclear. Skin macrophages and dendritic cells are believed to be the initial targets. These infected cells are thought to migrate to the lymph nodes and disseminate through the lymphatic system to other organs. Viremia, the presence of the virus in the bloodstream, may occur for 24 to 48 hours before the onset of symptoms. The presentation of dengue fever, whether asymptomatic, typical, or severe, is influenced by a complex interplay of host and viral factors. Severe dengue fever, characterized by heightened microvascular permeability and shock syndrome, is often associated with infection by a second dengue virus serotype and the patient's immune response. However, severe cases of dengue fever can also arise from infection by a single serotype. There are three main phases of dengue fever: febrile, critical, and recovery phase. During the febrile phase, individuals typically experience a sudden onset of high-grade fever, reaching approximately 40 degrees, which usually lasts for 2 to 7 days. Approximately 6% of cases may exhibit saddleback or biphasic fever, particularly in patients with DHF and severe dengue fever. Associated symptoms during this phase include facial flushing, skin erythema, myalgias, arthralgias, headache, sore throat, conjunctival injection, anorexia, nausea, and vomiting. Skin erythema manifests as a general blanchable macular rash within 1 to 2 days of fever onset and again on the last day. During the critical phase, defervescence marks a period when the temperature typically decreases to approximately 37.5 to 38 degrees, occurring between days 3 and 7. This phase is associated with heightened capillary permeability and typically lasts for 1 to 2 days. Before the critical phase, there is often a rapid decline in platelet count, accompanied by increased hematocrit levels. If left untreated, the critical phase can progress to shock, organ dysfunction, disseminated intravascular coagulation, or hemorrhage. The recovery phase involves the gradual reabsorption of extravascular fluid over 2 to 3 days. During this period, patients often exhibit bradycardia. For investigations, common laboratory findings include thrombocytopenia, leukopenia, and elevated levels of aspartate aminotransferase. Dengue can be classified into dengue or severe dengue, or dengue shock syndrome. Probable dengue is when the patient lives in or has traveled to a dengue endemic area and presented with dengue symptoms. Watch out for warning signs of dengue, which include abdominal pain, persistent vomiting, clinical fluid accumulation such as ascites or pleural effusion, mucosal bleeding, lethargy, liver enlargement greater than 2 centimeters, increase in hematocrit, and thrombocytopenia. Next, severe dengue is characterized by dengue fever accompanied by severe plasma leakage, hemorrhage, impaired consciousness, myocardial dysfunction, pulmonary dysfunction, and organ dysfunction, including transaminitis. Dengue shock syndrome symptoms include rapidly rising hematocrit, intense abdominal pain, persistent vomiting, and narrowed or absent blood pressure. Rapid laboratory identification of the dengue virus involves NS1 antigen detection in serological tests. Serological tests are only helpful after several days of infection and may yield false positives due to other flavivirus infections, such as yellow fever or Zika virus. Next, the treatment approach for dengue fever varies depending on the patient's illness phase. Patients without warning signs can typically be treated as outpatients with acetaminophen and sufficient oral fluids. In addition, educating patients about the warning signs and advising them to seek immediate medical attention if any of these signs occur is important. Patients presenting with warning signs of the disease, severe dengue fever, or having risk factors such as age, pregnancy status, diabetes mellitus, or those who are living alone should be evaluated for hospitalization. Individuals displaying warning signs can be started on IV crystalloids, or even colloids. Blood transfusion is indicated in cases of severe or suspected bleeding when the patient remains unstable despite adequate fluid resuscitation and hematocrit falls. Platelet transfusion may be necessary if the platelet count drops below 20K or if there is a high risk of bleeding. It is essential to avoid administering aspirin, NSAIDs, and other anticoagulants. No antiviral medications are recommended, and no laboratory tests can reliably predict the progression to severe disease. For prognosis, untreated severe dengue fever may have a mortality rate of 10% to 20%. However, with appropriate supportive care, the mortality rate can be reduced to approximately 1%. Complications of dengue are liver injury, cardiomyopathy, pneumonia, orchitis, oophouritis, seizures, encephalopathy, and encephalitis. For prevention, use bed nettings, insecticide-treated window curtains, mosquito repellents, and wearing long sleeves and pants, especially when going to dengue-endemic areas. Other prevention involves biological control like fish, predatory cope pads, and endosymbiotic control in ponds or places with mosquito larvae. And also chemical control like using larvicidal and applying insecticide sprays. For environmental measures, always identify and eliminate breeding areas, covered stored water. Health education to the public and vaccination like SID-TDV has been trialed in some countries. That's all for this video. Thank you.